Hello, welcome back to my channel. So I'm going to be talking about my cerebral stent that I had done exactly a week ago and how I'm doing so far. So we'll start with, if you haven't seen my angiogram or my last video talking about why I'm getting a stent, I will link those down below. But basically, I was having stenosis of the transverse sinus, and it was holding up a lot of pressure in my head, and it wasn't draining. And even with a high dose of Diamox that I was on, I wasn't seeing any results. I was still having headaches and vision issues, and the long-term high dose of the Diamox was causing other issues such as trouble eating, nausea. I also got really dehydrated while taking it, which amplifies all those symptoms because Diamox is a diuretic, and if you're dehydrated, it's really, really painful and hard on your stomach. So it was time to take action and treat the underlying issue, which was the stenosis. So for those of you who don't know, a stent is basically like a tube. They have to go in through an artery. I've heard some people go in through the wrist. My doctor actually goes in through the artery in your groin, and they go in through that artery, and they follow it all the way up to your brain. And I had an angiogram done prior, so we knew exactly where the stenosis was. We knew the high pressures in my head. We knew everything that it entailed. So all he really had to do was go up into there, verify exactly where he's putting it, put in the tube in that spot, and then do another dye test to see if I'm draining properly. And if it wasn't, he was going to see what those differentials were. So I got there on Tuesday. They got me in the morning. I think it was like 9 a.m. They checked me in. I met with an anesthesiologist. I hope I'm saying that right. Because for the angiogram, I was awake the whole procedure. The stenting, I was not. I was put to sleep for the procedure. So I checked in, I talked to everybody, I met this team, they wheeled me back. It was actually the same exact room that I had my angiogram. There were some of the nurses that were the same, and of course the surgeon was the same. They had all the IVs on me, and they tried to place, while I was awake, they tried to place an arterial line, which basically checks your blood pressure constantly. So if I were to start bleeding out, or if there was some sort of underlying issue, they would know right away versus like every 30 minutes when like the pressure cuff goes off. So they tried to place it in this hand. You can see I'm very bruised. By the way, you have to be on blood thinners for this procedure. So that is why a week later, I'm still very bruised. It's gonna take a while for this to kind of clear up. And it did not work. And they're like, oh, we'll just do the, put the arterial line in when she's asleep. And when they gave me the medicine to put me to sleep, I remember this bleeding, and I remember somebody rushing over to put pressure on it. That's how I fell asleep. So keep that in mind. And I did have some anxieties going into this because it is technically brain surgery. They're going in my brain. They're doing stuff. So I was scared going into it. Even though I knew the risks were low, it was still scary. And so going to sleep, I think that's why what happened next happened. But I don't remember waking up directly after anesthesia, but I guess when I did, I woke up panicked. I don't know exactly what had happened, but I guess the nurses told me that I started kicking and shaking aggressively and yelling for my husband's name. And I actually have bruises on the backs of my arms here, I'm assuming from them having to hold me down. So I don't know how strong I was during this. And I guess I had opened the artery in my groin after they had just sealed it because I had started panicking. And so when I remember waking up is in the ICU, and there were nurses kind of all around me, like putting pressure on it, and I remember shaking. And then they were like, we need you to stop shaking. And I was like, I can't stop shaking. Like, I think it's anxiety. I need to see my husband. And then they were trying to get me anti-anxiety medicine. And another nurse was like, okay, well, I'm gonna go get your husband, just calm down. And then once they stopped the bleeding, they were able to bring my husband in. and I was able to like start calming down. So likely it was an adverse side effect of the anesthesia plus maybe a mixture of anxiety like coming like out. And when I actually like woke up, I had an IV in the back of both my hands. I had the arterial line in this one, which is kind of bruised. You can see that little bruise right here. And then this had like a bandage on it because of the bleeding. I will put a video right here of what it looked like. And then, Zoe, go away. Sorry, my puppy's here. And then after the, they also had on my legs, because I was in the ICU for this, so of course I'm being monitored very carefully for bleeding and everything. So you have to stay the night or at my hospital when you have this done. So go. I know you just want to play. And so I also had, Zoe, come on, let go. I also had these like boot cuffs that they would like fill up with air to like kind of squeeze my leg a little bit, not very tight, just like squeeze it and then let go. And I guess that was supposed to help with circulation or something. So I had those on both my legs, and then I had a blood pressure cuff, and that was it. And I also had a catheter because I couldn't get out of my bed. So for the next 24 hours, I just stayed in bed like that. The nurses did like have me lay side to side. They put wedges, but I wasn't allowed to move. They would like move the sheets under me, and they'd have me lay side to side. And then they had to check the access site every half hour because if you remember from my angiogram, when you bleed out, they have to check it regularly because that's an artery. They don't want it to bleed out. So they did that. And I was seeing results from the stent pretty much immediately after. I felt okay. I had a headache, and that was it. I did get some ibuprofen. Sorry, not ibuprofen. I got Tylenol. I am deathly allergic to ibuprofen and aspirin. So I did have an allergy band on, but I had Tylenol given to me, and I did notice a difference in the hospital. But it wasn't a pressure headache. It wasn't nearly as bad as a pressure headache. It just was like a annoying headache. If I coughed or sneezed, I could feel where the stent was, which was really kind of scary. Yeah, I still get that now. And so that was a new sensation. Once I was like getting close to me leaving the hospital, I had to get cleared because I was in the ICU. I had to get cleared by a physical therapist to make sure I could walk. And as soon as I was able to get out of bed, I immediately noticed way less pain. My angiogram, I was so sore after. It took like 2 weeks to recover from. It was very painful. This surgery, as far as the groin site, was not painful at all, the recovery. The most painful part has been this guy, this left wrist, because of all this bruising. That's it. That's really it that I can think of as far as pain goes. I did still have a headache. Since leaving the hospital, every single day I have seen improvement. My headaches have gotten less and less. I'm at a point now where if I have a headache and I take Tylenol, it gets rid of it, which would have never happened before the surgery. There's nothing you can take to relieve pressure headaches. Like there's nothing, no kind of pain medicine, at least for me, maybe because of my allergies, but there's anything that I took, like migraine medicine, like sumatriptan, nothing would touch the pain that I would get from the pressure. So the stent has definitely done its job. The surgeon actually told me when he did a dye test after the stent, before he did the stenting, the stenosis was so severe, my pressure was at 40, which is supposed to be at 20. It was at 40 before the pinching, and it was at 14 after. He put the stent in where it was pinched off, and there was no more holdup of pressure at all. And my left side was my worst side. So I now have one functional side of drainage, which is amazing. And I do still have stenosis on my right side. He did not put a stent on that side. And it's very likely I could go many, many years before needing another stent placement, which is amazing. We were immediately able to cut my Diamox dosage in half, which is phenomenal. I've already seen improvement from that. So instead of doing 2,000 milligrams a day, I'm now 1,000, so 500 in the morning, 500 at night. And the end of the month, I'm gonna check in with my surgeon and we're gonna cut that back. So the goal is in a couple months to get me off of Diamox, but slowly to taper it off. And yeah, that's where we're at. I've noticed night vision has gotten better. I've seen improvement driving at night in low lit lighting. When it's pitch dark in the room, I can actually see the white walls. It used to be anytime there was low lit or like if the lights were off in a room, no matter how much my eyes tried to adjust, it was pitch black always. I could not see anything in the dark. If it was dark outside and I was walking from like an area with no lighting, I couldn't see anything, no matter how bright the moon was. Like that's how dark my vision was getting. And now I don't have that issue at all, which is amazing. I do still have my glasses. I had to get new ones because my dog my puppy chewed up my other ones. And they're a low prescription and they help me with everything. They are amazing. And yeah, I think that's all I have to say. That's all the questions that I had as far as like, how was the surgery? How was recovery? How am I doing now? And as far as the future goes, I'm hoping to get off Diamox. I'm very likely going to go into remission. For those of you who don't know, you can't cure intracranial hypertension, but you can go into remission. Unfortunately, various other factors can always heighten your pressure and cause issues, but as of right now, I'm feeling the best that I've ever felt in many years. I never thought that I would feel this good again. I thought I was always going to be in pain, and to be honest, before the stenting, I didn't see a happy future with myself. I thought I was always going to hurt. I thought I was going to get sicker, and I was very pessimistic thinking. I was just very sad. And so it's really nice to have like a clear mind and feel good and be able to eat and sleep really good and see it's changing my life. I am on such a high with life right now, and I'm just so happy. So I'm really glad that I did it. I would 1,000% do it again, no matter, like it was, the angiogram was a little traumatic for me, I'm not gonna lie, but I would 1,000% do it again, and the stent in a heartbeat to get to where I'm at now. Even if I never get off Diamox, I am still much happier where I'm at now than what I was before the procedure. So that is all I have to say as far as the stent goes. If you have any further questions, let me know in the comments or send me a message on Instagram. I'll have all that linked in the description, and I'll see you guys in my next video.